Okay, First Lady, over to you.
Thank you, Shannon. Hello, everyone, and thank you for joining us. Today's episode of Ask an Expert centers on oral health, the value of dental care for our mothers and their children in their early years, and how the disparity of dental care access is being addressed in communities across New Jersey. Oral health is maternal health. Without proper care, tooth decay and gum diseases can lead to poor health outcomes down the line for both mom and baby. Increasing access to quality health care, which includes dental care, is an essential part of our work through Nurture NJ, which aims to transform New Jersey into the safest and most equitable state in the nation to deliver and raise a baby. Despite the urgency of good dental care, it can be hard to access for many families. Low-income children, especially children of color, are at the highest risk for dental decay in the country. A study from the National Center for Health Statistics found that from 2015 to 2016, Hispanic children between the ages of 2 to 19 had the highest prevalence of total cavities or tooth decay, and Black children had the highest prevalence of untreated cavities. Not to mention, dental issues can carry a heavy stigma. According to the CDC, nearly 30% of low-income adults report that the appearance of their teeth and mouth affects their ability to interview for a job, which can be an added stressor for a pregnant mother or a new mother. Parents, especially those who are expecting, juggle a lot of responsibilities, from childcare to work to school and doctor's visits. We are here to make life easier for you and your child and provide an overview of the resources available right at your fingertips. And the decision regarding what kind of dental care services are correct for your family can also be challenging, which is why I'm thrilled to welcome our guest experts and begin our discussion. With us today is Dr. Nicole McGrath, founder and CEO of the Kindersmile Foundation, Inc., established as a charitable organization in 2007, based on her personal exposure to the disparity of dental care access in Montclair, New Jersey, where she ran a private practice for nearly 25 years. She is lovingly referred to by her patients and community partners as Dr. Nicole. She is a tireless advocate in reaching out to at-risk children in her community who lack access to affordable dental care. Welcome, Dr. Nicole. Also with us is Jelen Perez, a mother of 3 and a Kindersmile Perinatal Health and Wellness Program participant this year. She received oral education and a year's worth of dental services up to $1,500 from Kindersmile. Welcome, Jelen. Bienvenida, Jelen. And alongside Jelen, we have one of my wonderful team, Pietra Camargo, who will be translating for Jelen as we move through this Facebook Live event. So welcome, Pietra. Next, we have Dr. Elisa Velazquez, a board-certified pediatric dentist. She owns 3 private practices in Ocean County, New Jersey. She serves as the vice president of the New Jersey Dental Association, the president of the New Jersey Academy of Pediatric Dentistry, and the president of the New Jersey Hispanic Dental Association. She is the staff dentist for Children's Specialized Hospital in Toms River and Mountainside, and is chief of dental for Barnabas Health Community Medical Center in Toms River. Welcome, Dr. Velazquez. Also with us is Dr. Darwin Hayes, who serves as the state dental director at the New Jersey Department of Health. Dr. Hayes previously served nearly 7 years as the lead co-director of the general practice residency program at Bronx Care Health System in the Bronx. Additionally, he served as chair of the administration board for the American Dental Education Association's Council of Advanced Education Programs. Dr. Hayes is the proud dad of his 14-year-old son, Donovan. Welcome, Dr. Hayes. And our final panelist is Dr. Tanya Cook. She worked for Merck Pharmaceuticals as a microbiologist for several years, and then decided to pursue a career in dentistry. After several years in private practice, she worked as a staff dentist at the Plainfield Health Center in 2000. In 2006, she joined the Jewish Renaissance Medical Center in Perth Amboy. currently, Dr. Cook is a Vice President and Chief Dental Officer for CamCare Health Corporation in Camden. Welcome, Dr. Cook, and thank you all so much for taking the time to be here. I want to get right into our Q&A, but of course, if there's anything further any of you would like to add about your backgrounds, please feel free to share with us as you answer your first question. And for all viewers joining us, please feel free to add your questions to the comments sections, and we will get to those if we have time. Okay, so here we go. Our first question is for Dr. Hayes. Dr. Hayes, why is it important that pregnant moms take care of their oral health?
Well, real quick, one basic, simple reason. If you look at a mother and you look at their mouth, what do they have? They have a smile, they have a teeth. They use their teeth to do what? To chew. They use their mouth to do what? To talk and give instructions to the kids. And then they also use their mouth to do what? To smile. So mothers need to make sure that they take care of their oral health for those basic, simple reasons, right? Mothers have smiles and teeth and a mouth as well. Second, real quick, is we know that through pregnancy, there are a lot of changes, physical changes for mothers. And those physical changes also can manifest intraorally, right? With hormonal changes. Lots of times mothers will notice some changes with their gums, swollen gums, maybe even bleeding gums as well, all due to changes that are going on throughout the body. So those are two main and really basic reasons why pregnant moms need to make sure that they are taking care of their oral health.
Thank you so much, Dr. Hayes. I think that all makes sense, and expectant mothers want to do what is healthy for their babies, and the way to get them a head start to put them on the path to good oral health. Maintaining good oral health during pregnancy is especially important. So my next question is for Jelen. Jelen, what made you choose your dentist? How did your dental habits change once you became pregnant?
Hola, Jelen. La pregunta entonces es, ¿qué te hizo elegir a tu dentista? Y también, ¿cómo cambiaron sus hábitos dentales una vez que se quedó embarazada?
Ok, pues a mí me lo recomendó una mi amiga, me recomendó el dentista, ¿verdad? Que ella había ido ahí, pues le había gustado. Y pues hice la cita y me gustó mucho el trato que le dan a las personas, y pues hasta el día de hoy ahí estoy yendo con el dentista. Y ya cuando salí embarazada sí cambió bastante porque, por ejemplo, a mí me ha dado mucho sangrado en las encías, entonces ya eso cambia cuando uno tiene los embarazos, ¿verdad?
Gracias. So Jelen said that she actually had a friend who recommended Kindersmiles to her. Came really highly recommended, and then when she went herself, she really liked how she was treated. She liked the atmosphere, and so that's why she ended up continuing her treatment at Kindersmiles. And she said that when she became pregnant, she noticed that she had, a lot of bleeding gums and those sort of changes. So another reason why she continued with her dental care.
Fantastic. Well, please tell Jelen, I know Dr. Nicole personally, and I can attest that she has an incredible bedside manner, and I suspect she welcomed Jelen and her children with open arms.
La primera dama dice que ella conozca a Dr. Nicole personalmente y sabe que ella es muy amable y también debe ser lo mismo con sus hijos.
Okay, with that, my next question is for Dr. Nicole. So Nicole, what are some common misconceptions about perinatal and infant oral hygiene that you might like to address?
Great. Good afternoon, all, and thank you so much to First Lady Tammy Murphy and my colleagues. This is such an important issue to us, and I'm glad that we're all here together discussing this. I think one of the most common misconceptions is that pregnant mothers, perinatal mothers, oral hygiene can affect the developing child or fetus. That's a big no-no. Poor oral hygiene during pregnancy can directly affect the developing infant and can possibly lead to preterm delivery and low birth rate, depending on the severity of the mother's oral disease. During pregnancy, just as Dr. Hayes had mentioned, mothers get lots of hormonal changes. 60 to 75% of pregnant mothers have gingivitis, which is inflammation of the gingiva or gums, so to speak. And if untreated or not under control, then it can lead to periodontal disease, which that is bleeding gums, loose teeth infections, which is another severity which can affect the outcome of the infant. Another misconception is that perinatal mothers, pregnant moms say that if I kiss my baby on the mouth or I clean their pacifiers off if it falls on the floor with my own saliva, that's okay, that's acceptable. Absolutely incorrect. The acid-bearing bacteria that causes the oral disease in perinatal or pregnant mothers can be transmitted to the child. So it is very, very important that we educate our perinatal moms and our pregnant moms of the do's and the don'ts, because there's so many misconceptions. Another misconception is that mothers should not be seen by the dentist during their pregnancy, that it's dangerous. That is a huge misconception. Being treated by a dentist, being seen by a dentist during your pregnancy is not only safe, but it's so important to prevent these poor outcomes, not only the poor outcomes of the mothers, but of the unborn child. So it's highly recommended that all perinatal pregnant moms be seen by the dentist, and it's absolutely safe to get comprehensive quality dental services during pregnancy.
Wow, those are some serious misconceptions, and I'm really glad that you cleared those up for us. Thank you so much. Our next question is for Dr. Velazquez. So Dr. Velazquez, how often should a pregnant mom go to their dentist?
Yes, hi everyone, and thank you again, First Lady Murphy, and all my friends on here today. So I just want to highlight some things that Dr. Hayes and Dr. McGrath have mentioned already. Absolutely, it is safe and super important for the pregnant mom to go to the dentist. So that is super critical, and keep up with their regular appointments. So everyone should be seen every 6 months for their routine checkup exams and for a cleaning. If the mom is experiencing specific issues, as mentioned, the swollen gums, bleeding gums, the gingivitis, they should absolutely call their dentist right away to be seen, because those problems can begin to escalate and snowball on the mom. And the other thing to keep in mind, some of you may have experienced this as well. Sometimes you can experience nausea and vomiting during pregnancy, and then that acid coming up from being nauseous can affect your enamel as well. We also all know that pregnancy makes your eating habits a little bit different. You might be snacking more, so you could technically be prone to more dental problems. But it's all about prevention. And if you do have any dental problems, to try to keep that under control prior to that baby being born. Absolutely, we do know now that the bacteria in the mom's mouth can be given to that child, to that baby, before they even have their teeth, and it starts establishing the bacteria in their mouth. So if mom has a dental infection or a big cavity, that bacteria, unfortunately, can be passed on to the baby, setting them up, unfortunately, for problems before they're even 1 year old. So absolutely, pregnant moms out there, please follow up with your regular dental visits. And then the baby should be seen first visit for sure. Thank you.
So to all our pregnant moms watching us today, Dr. Velazquez is here to remind us just how critical it is to go to your dentist appointments. Oral health is maternal health, and please remember that. Okay, now back to Jelen. Jelen, how did you find your child's dentist?
Jelen, ¿cómo encontró el dentista de su hijo? Yo sé que anteriormente dijo que tenía una amiga que recomendó el Kindersmile, pero usted estaba buscando un dentista para usted o para sus hijos. Está en mute.
Disculpe. Sí, al principio para mi hijo, porque no los había tenido con el dentista, ¿verdad? Entonces, por medio de esa amiga, ella me dijo que ella había llevado a sus niños y que le había gustado mucho al niño de ella estar con el dentista. Pues igual hice una cita para él y para mi niña, y de una vez hice una cita para mí. Pues me gustó mucho la atención, como le digo, y a mi niño le daba mucho miedo. Y pues el primer día, creo que fue la doctora Nicole, creo que lo atendió, y pues estuvo muy divertida la consulta. Ella le enseñó un peluche cepillándose los dientes, y él le encantó eso, y incluso él se dejó él solito en la silla, ya no tuve que cargarlo yo.
Gracias. So I was just going back to what Jelen has said earlier about she had a friend that recommended Kindersmiles to her. So initially she was looking for a dentist for one of her kids. She has 3. And then she ended up getting an appointment for him, and then for her other child. And then she ended up getting an appointment for herself. And she was just really happy with the attention that she and her kids were receiving. One of her kids, who does not like the dentist, had a really good appointment with Dr. Nicole. And he, came out of there very happy and, actually enjoying the consultation.
I know that mothers really love to hear directly from their peers about their lived experiences. So thank you so much for sharing, Jelen.
Jelen, sabemos que las madres buscan a compartir sus experiencias con otra. Entonces, muchas gracias por estar aquí y compartiendo sus experiencias para que otras mamás también puedan saber dónde buscar la información.
Ok, de nada,
Okay.
sí es. Sorry.
No, go ahead.
Puede ir.
Ok, sí, muy, muy bueno. Como le digo yo, con mis amigas igual, hay personas que le preguntan a uno que ¿dónde va usted? ¿Dónde lleva a sus hijos? Pues igual para mí ha sido muy bueno, y yo he recomendado, ¿verdad? Kindersmile.
Gracias. So she said that, just talking among, the moms, and they're able to make recommendations to each other. And it's been really helpful sort of having that community and somewhere to go to share this information.
Fantastic. It's great because Jelen is also serving as a shameless commercial for Kindersmile, which we are loving. So good job. Okay, next we will ask Dr. Cook. Dr. Cook, when should a mom actually start bringing her child to the dentist, and how often should children go to the dentist for regular checkups?
Happy Wednesday, everybody. And First Lady Murphy, thank you so much for this wonderful topic. Of course, I love dentistry, and we love to see our babies and moms happy and smiling. So our rule of thumb is first tooth or first birthday. That is by far the first time you should bring your child to the dentist. A lot of our dental providers are seeing the babies earlier, like shortly after birth. And, parents have asked why they don't have any teeth. Why should I come? But it's an educational process. And it's also to show them how to take care of the gums and what to look for, and not put your baby to get bed with the bottle of juice and milk and just nutritional information. So it's a nice bonding opportunity for the dentist and the mom and the baby also. And so they're not afraid to come back to the dentist. So you don't have to wait for that first tooth, but by far that should be the drop dead first time you should bring them in. And twice a year, every 6 months, you should come in for a checkup, cleaning, and get some wonderful vitamins, fluoride on your teeth.
Okay, so I heard first tooth or first birthday, and
Yes.
and I love that, twice a year. Great, thank you so much for helping us out with that, Dr. Cook. Okay, now I'd like to turn back to Dr. Hayes. Dr. Hayes, what questions should a parent ask when looking for a pediatric dentist?
Ooh, that's a good one. That's a good one. I have a few, and I know probably Dr. Velazquez probably has a couple as well. So those that are listening, get out your pen. Here we go. Here's one. Why should we choose your office? That's a great question to ask, right? And one of the reasons why is because pediatric dentists have several years additional training. They are experts in being able to handle your child, even though you may not think your child is special at times, but pediatric dentists have that training. They're more knowledgeable about your children's teeth, their evolution, their development as well. And working with an expert in this field of this segment of dentistry really ensures that your child will have some excellent care. So that's one question. First question. Another question, do you take my insurance? Or do you accept my insurance? Really important, right? For some families, that can be the driver as to where they go or where they don't go. And having dental insurance or having access to insurance makes dental care affordable. So great question to ask as you're doing your research. Another question, how will you handle my child's first visit? What should we expect, right? As parents, we get kind of overwhelmed with that first visit as well, in addition to the child. So having an idea as to what you and your child can expect that first visit helps to kind of ease some anxiety that you may have, and you having more reality as to what's going to happen at that first visit and those subsequent visits as relates to oral health care. Another question is finding out more about the provider's reputation in the community, whether it's are they part of a practice, or is that practice, that office that's well respected, a place that a lot of people will refer to through family and friends. Is always good to learn about the reputation. What's the office environment like, right? Very important. You want to be in a welcoming environment where it feels like home, right? It's a dental home, but you want it to feel like home and have people that welcome you and treat you well. And then one last question I think is important is finding out and determining whether or not the office maybe offers a free consultation, right? A free consultation. So why is that important? Well, it's part of the research of trying to find out more about an office, but you can only find out so much in that research process online. You may have some word of mouth, but wouldn't it be nice if you could go to the actual office, talk to the dentist, see the environment, see how it's laid out, see whether or not it's really going to be a home for your child and the rest of the family. Also, that allows you to have an opportunity to ask maybe some specific questions directly to the staff and to the dentist as well. So those are some preliminary questions that families can ask when they're looking to choose a dentist.
Fantastic. Thank you so much. Dr. Velazquez, did we forget anything that you want to throw in there, or are you good?
No, I think Dr. Hayes covered it all, but yeah, those are all really great questions. Most offices have websites, maybe videos, YouTube videos. You could check all that stuff out. And you want to gel with the office and the environment, because you do want to create that dental home. You want to feel comfortable.
Great. Thank you both for sharing. I think it is really critical that you ask the doctor the right questions and stay informed about the oral health of your child. Okay, moving on, Dr. Nicole, wonder what actions can parents take to enable and encourage their children to maintain strong dental hygiene?
Okay, so parents are the best role model. My favorite saying, even as a mother, is children learn what they live. So at Kindersmile Community Oral Health Center Dental Homes, we stress education, prevention, and intervention. And we encourage our mothers, our parents. I mean, a lot of our families are from single parent, but we encourage the parents to please have their children brush their teeth along, make it a family project. Kids are going to learn what they see, not necessarily what you tell them. So we say, do it in a fun sort of way every time. It doesn't have to be twice throughout the day that you do it, but select a morning if you're a morning person, or the evening, and involve your child going over the proper oral hygiene instructions, circular motions, even flossing, brushing the tongue. They will follow your lead. So we definitely encourage parents to do that. And as the child gets older, maybe even say, why don't you select a day and a time that we can do it? And why don't you lead me? You show me. Therefore, you can ensure that the child is doing proper oral hygiene. I think that's always the best to do things together, because they're going to follow your lead as parents and as mothers.
Thank you, Dr. Nicole. So parents, remember to keep it fun and to stay current with your child's dental hygiene, and kids have to make sure you brush your teeth before you go to bed.
Yes.
Okay, so Dr. Velazquez, for a lot of kids, the dentist is an unfamiliar experience and they are nervous to attend appointments. What can parents do to help their children overcome any uneasiness about going to the dentist?
Yeah, that's a really great question. Well, the first thing is sometimes parents experience, unfortunately, bad experiences in their own personal lives. And I always stress to them to keep that on the down low. That should be something that only adults are discussing, because parents might be talking about it and instilling a fear in their children before the child even goes to a dentist. So often people are afraid of things that are unknown. So kids could be nervous or fearful of going because it's just something new and the unknown, or they heard mom or dad or grandma or big brother talking about some bad experience. I often tell parents, kind of be careful with some of the words that you use. Sometimes dad thinks he's funny and it's like, oh, you might go to the dentist tomorrow. They're going to put that big needle in your face. And that's never a good thing. So be careful with some of the word choices. But what we do advise, especially for the very young children, preschool age, is there's so many great books out there on going to the dentist for the first time. If they don't have access to that, there are so many videos on YouTube. They can access videos from different places. Different apps have some fun stuff to make going to the dentist and dental stuff more enjoyable and fun. If they decided on a specific office, some offices have YouTube videos specific to that office. And there's something else that I love. It's called a social story. So a social story are picture books of different experiences. So there are social stories out there for going to the dentist. And that really helps all children, but especially like preschool age. But that's also really great for special needs kids so that they can anticipate what will happen in advance. So some kids, they want to know every detail about what's going to happen step by step. And they can see those like picture books or videos of what will happen. And just a fun conversation, making the explaining to the kids that the dentist is your friend and they're a trusted adult, and that it's going to be a great visit. We always advise people not to lie to their kids about all the details, but to allow the dental professional to do most of the talking, so that we can use more child appropriate words, and make it more friendly. And then we make it like a family affair, but it's all about making it fun and positive. And the best way to do that is by starting the visits early. Like Dr. Cook said, the earlier the better. Then we're preventing issues. If the first visit is a 9-year-old that has a facial swelling with an infection that requires unfortunate dental work, that's going to be tough to make that a really positive visit. So it's all about the prevention, and that starts young. Thanks.
Thank you, Dr. Velazquez. The ongoing theme of keeping things fun. Keeping children at ease will provide them with an enjoyable experience and allow them to create happy memories. Okay. So back to Dr. Hayes. Dr. Hayes, what precautions have dental offices taken to keep their patients safe during the pandemic?
Great question. For many people that have been to the dentist's office these last 2 years, they have seen a lot of the precautions and updates. But keep in mind the precautions related to like infection control in dental offices have always been a mandatory duty and responsibility for oral health practitioners. So like, for example, in addition to having to wear masks that cover your mouth, our mouths and our nose, and wearing gloves, all of such to prevent airborne bacteria and bloodborne bacteria from entering the airways, skin surfaces for the entire team that are working chairside. We in oral health repeatedly disinfect and sterilize the instruments, all the motorized devices that we use, the countertops, the chairs, just everything that's in the room where our oral health treatment is delivered. Additionally, during the time of COVID, there were additional protocols that were instituted, some of which are similar to things that had happened even before, protocols that were in existence before COVID. Like, for example, if it's known that you're sick or not feeling well, we have told patients you need to reschedule your appointment. Don't bring that. Don't bring your sickness into the operatory, into the office, please. Again, all to prevent the transmission of unhealthy bacteria and viruses. But during COVID, some of the new protocols that were and considerations that were implemented really were not necessarily basic, but they were to prevent the transmission, right? So some of those protocols included patients having to test anywhere from 24 to 72 hours prior to their dental appointment and sharing the results of that test. We had to limit the number of appointments in a given day. So say if we were normally seeing 20 patients, we typically had to cut those in half to limit the amount of traffic and potential exposure in the offices. We also strongly encourage patients to use a special mouth rinse, antibacterial mouth rinses prior to care, especially if we knew that we were going to be doing something that could emit a lot of aerosol or a lot of airborne bacteria. In addition to that, we reinstituted and really just increased the amount of high vacuum removal of airborne bacteria, not only in the office, in the operatory, where we had air purifiers, but also with the suction, the vacuum that gets anything around in your mouth and also that comes out of your mouth as well. Some offices even included using what's called, what is it called? It's called ultraviolet germicidal removal energy units. Many of us, if you've gone to you may have seen it and didn't even know what it was. If you go to the emergency room, up top, you see these vents that have these purple and blue lights. Those are ultraviolet lights that remove bacteria that are in the space. Some offices constructed and or added those devices as a way to kill any bacterial, any viral or fungus type particles that were in that could be transmitted during those dental visits. And then last but not least, we saw a silver lining in the amount and the use of telehealth services, right? Where a lot of practitioners were still able to stay in communication with patients, but do it via telehealth. So again, those were some of the updates that were and precautions that were taken during the COVID pandemic, which we're still in. So there you go.
Thank you so much. That all makes great sense. Pandemic safety protocols are obviously important to keep mothers and their babies safe. Okay, now, Dr. Cook, how can parents without private insurance find dental care for their children?
Great question. I work for a federally qualified health center. We have 23 in the state of New Jersey with 129 sites. We do not turn away any patient because of their inability to pay. The beautiful thing about FQHCs is that majority of us will either have a Medicaid outstation worker working there, and we have financial advisors that will help the parents get their children into insurance payer mix. And if they do not qualify, we do have sliding fee scales. And also on top of that, we do have funding. A lot of us have special funding to be able to provide those services for their patients. So there's no reason why children should go without being seen. And then of course we have partners like Dr. McGrath that are in 2 locations throughout the state. And we have other partners that we can get them in a dental chair to make sure that they are seen and healthy and smiling and having a great time and enjoying oral health.
Fantastic. Thank you so much, Dr. Cook. Okay, so my next question is for Dr. Nicole. Can you please share some more information about Kindersmile? Shameless advertisement here, Nicole. And what kind of programs you offer?
Yes. Okay, so Kindersmile is a 501c3 nonprofit organization that was founded in 2007. We're not a federally qualified health center. We're not hospital-based. We're not private practice. We're not a Medicaid. We created and established our own platform to increase access for all, for those who have no insurance to those who have private insurance. We currently have 3 dental homes. The first one is Kindersmile Community Oral Health Center located in Bloomfield. That was established in 2016. In 2019, we partnered with the Boys and Girls Club of Newark, and we took over their dental center there. So that's the second dental home and the second satellite dental home. And we have opened up that dental center not only to the members of the Boys and Girls Club of Newark, but also to the Newark community. So we have children that are in the surrounding area in Newark that come to get their comprehensive dental services at the Boys and Girls Club, and they don't have to be a member of the Boys and Girls Club of Newark. And our third dental home is located in Trenton, and that was opened during the thick of the pandemic. Both Newark and Bloomfield, we see children ages 0 to 21, including special needs patients. And in Trenton, we see children as well as adults. We are very grateful for our partnership with the FQHCs, CamCare, Zoo Fall, Newark Community Health Center, and Henry J. Austin. We could not do what we do without our community partnerships. And that was one of the reasons that Kindersmile Foundation decided to expand the services to the adults in Trenton, because Henry J. Austin could not do it by alone. We are culturally sensitive, all of our dental homes. That's why we're so happy that Jelen Perez joined us, who is part of our perinatal program. We make sure that in terms of being culturally sensitive, we have our staff. A lot of our staff members are bilingual, from Creole to Spanish to Arabic, because we want to make sure that anyone who walks through the doors of our dental home feel at home and feel that we are taking that extra step to make sure that not only do they get comprehensive dental services, but they feel that comfortable, that there's other staff members that can relate and translate. We accept Medicaid, managed care. We provide free dental services to those who are undocumented and who cannot get NJ family care. So they do get free dental services. Our programs that we have our perinatal health and wellness program, where we invite 75 at-risk uninsured mothers we educate them for about 3.5 hours, really stress education, intervention, and prevention, so that they can understand that oral disease is the #1 preventable disease. And then once they complete the program, because we believe that the missing piece of the puzzle is really the education. So once they're educated and they finish the oral educational program, they transition to our clinical side of the dental home, and they get 1 year's worth of free dental services up to $1,500. And we know that $1,500 is not a lot when it comes to services, but trust me, it's a big help. It's a big start. Jelen was able to receive a 4-unit bridge, anterior bridge. She came in with no teeth in the front of her mouth. Now she has a fixed bridge, and she's smiling. She's empowering her community, and she's doing outstanding. Our second program that we have is our community service learning program, where it's a mentorship program. We invite high school, college, pre-professional students to come and mentor with our dental professionals. We encourage them to give back to their community and go out to the various community events. They learn about public health. They learn about the clinical aspect of the profession, as well as the administrative aspect. Most of them are interested in pursuing a career in dentistry, and we do assist them in getting accepted into dental school. So since inception of this program, we have assisted over 55 students from high school through college, and that are now in dental school, and a few of them have come back to serve the marginalized community. So we're so proud of those students. A third program that we have is our oral health program. That is our premier program, in which we partner with all of our community organizations, including our schools, Department of Health, TASC, Trenton Area Soup Kitchen, Head Start programs, public schools, women homeless shelters, you name it. If they serve our demographics, we're going to partner with you to increase oral disease awareness and make sure that we try to eradicate this #1 preventable disease. A fourth program is our GBAS. It's called Give Back a Smile. That is where I become an annoying colleague and call all of my colleagues or text them all throughout the night and say, hey, instead of golfing on that Wednesday, can you come on in and help provide quality services to the uninsured? So, and eventually they end up saying yes. So we have over 25 private practicing dentists who give up their time at no cost to come into one of our dental homes, provide comprehensive services to our uninsured, undocumented population. Therefore, we are able to provide all of the services to our marginalized communities that they would otherwise not receive because it's too expensive. So in Trenton, we do implants. We have a periodontist who flies in from Florida once a month, and he does free implants. And therefore, we're able to provide those implants to our adults for $1,700. That's unheard of. Am I right, colleagues?
Unbelievable.
Unbelievable.
Dr. McGrath, thank you so much. We are running out of time.
Oh, yes.
So I hate to cut you off, but
okay.
I think I wanted to just quickly go around to the others who have not had a chance to speak for the last several minutes and just say thank you to everyone. Jelen, if there's anything you want to add, any piece of advice that you might have for other moms, please feel free to answer right now. And if not, no problem. Pietra?
Jelen puede compartir un consejo para otras mamás que buscan un dentista.
Sí, por ejemplo, les diría de que pues vean dónde los niños se sienten más seguros, ¿verdad? Que aparte de que sea muy higiénico, muy limpio, que los niños se sientan seguros y la forma que los dentistas tratan a los niños es muy importante y pues si es Kindersmile es mejor.
Gracias. So Jelen said that, of course, to find a dentist where your kids feel comfortable, an atmosphere that is welcoming, and also an office that is clean and hygienic. And then she said, of course, Kindersmile.
Fantastic. Thank you. Okay, so for Dr. Velazquez, Dr. Cook, Dr. Hayes, is there, maybe in that order, if there's any last words of advice you want to share with us, please lean in. Dr. Velazquez?
Yeah, I just want to stress that it's so important, get your kids to the dentist. If you didn't bring them yet and they're 2, 3, it's never too late. So schedule the appointment. Obviously, the sooner the better. And for the pregnant moms out there, get yourself to the dentist. You have to take care of yourself before you can take care of your kids. And through the New Jersey Academy of Pediatric Dentistry, you could always go on that website. It lists the pediatric dentists throughout the state. Most of us are board certified specialists. You could also contact us through the New Jersey Hispanic Dental Association. We could help people find dentists that speak their language, and through the dental association as well. But thank you for doing this. This is so critical. So keep smiling, everyone.
Dr. Cook?
Yes, absolutely. Ditto to everything. The bottom line is oral health is a part of overall health. So when you take your children to get their physical, their well child checks, take them in for their oral health checkups, cleanings and checkups, just to make sure that everything is fine. And you may think that they have a beautiful smile, but let's continue to make sure and bring them to us so we can make sure that we can provide our little razzle dazzle and make sure they leave smiling and happy and smiling. And thank you again, First Lady.
Absolutely. And to our State Dental Director, Dr. Hayes.
Just to reiterate, and just sum up what everyone else has already said, oral health matters. If you like to talk, oral health matters. If you like to eat, guess what? Oral health matters. If you like to smile, oral health matters. It's part of what we do every day, and it's definitely part of your physical health as well. So again, thank you for this platform, First Lady. Wahoo wah.
I hear that. Okay. Okay. So kudos, first of all, to my fabulous team for assembling this great, incredible group of experts. And to that, I say thank you to our experts for sharing your time and all of your expertise with us today. Really appreciate it. As always, you can find our entire Ask an Expert series on my Facebook page with interviews with a broad range of experts. So please don't hesitate to use it as a resource. I want to thank our panelists for taking the time to be here, your thoughtful responses, and of course, your dedication to New Jersey's mothers and babies. And thank you to all of you watching at home. Apologies, we couldn't get to any questions you might have had online, but I think you learned a lot of great things today, and I deeply appreciate your joining us. We'll see you again next month for another installment of Ask an Expert. Thanks, everybody.
Thank you.